Hi and welcome. I'm trying to learn medicine today, chlamydia infections. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, then it's with the honest. And we're talking here about illnesses. And this is no medical advice, we're just learning about it. Chlamydia infections. Chlamydia are small bacteria that are now known to be responsible for a variety of infections. Okay, there are bacteria, very small things, and there are some chlamydia bacteria, and they are responsible for many different types of infections. Until recently, the organisms went unnoticed, but now their importance is being increasingly recognized. The book is from the 80s. Okay, previously we didn't really know what it is, or that it existed, but now they know it is important for many different diseases. Diagnosis of chlamydia infections can be difficult, but they respond to antibiotics. Diseases caused by chlamydia includes, they are hard to diagnose. Chlamydia infections are hard to diagnose, but they can be treated with antibiotics. And these chlamydia bacteria can cause other types of diseases. For example, listed here now, trachoma, that is the commonest treatable cause of blindness. So people can get blind because of trachoma, and trachoma is caused through a chlamydia infection. Infant pneumonia can be also caused through a chlamydia infection. Non-specific uveitis, a vernal disease more common than gonorrhea. Why are there two R's? Why is there an O? Gonorrhea, I'm going to pronounce it gonorrhea if it's something else. Gonorrhea. And on the increase. Non-specific uveitis, a vernal disease more common than gonorrhea and on the increase. Okay, it's on the increase. The uveitis. Okay, people can have gonorrhea. It's just gonorrhea. People can have gonorrhea, and people can also have non-specific uveitis. And this non-specific uveitis is more common to come, and that can be caused through a chlamydia infection. Salpingitis, infection of the female fallopian tubes that may result in sterility. That means, does it mean that the people can't get children anymore? Sterility, is there a special term for it? Okay, so it can cause salpingitis. Epididymitis, infection of the epididymitis, the tube next to the testicles. Okay, whatever, it can cause infection of the epididymitis. The third one is a Y. There are 4 I's in the word and a Y. Epididymitis. Lymphogranuloma venerum, a vernal disease that causes swelling of the lymph glands in the groin of both men and women. It causes swelling of the lymph glands in the groin. Lymphogranuloma. Reiter's disease or arthritis or conjunctivitis and refritis occurring together. Okay, Reiter's disease, and that is arthritis, conjunctivitis, and uveitis occurring together. No, 3 or 2? Whatever. Reiter's disease. And psittacosis, a form of pneumonia caused from birds, especially parrots. And what has it not to do with chlamydia? Do people get chlamydia from the birds? Okay, it can cause psittacosis, that is some form of pneumonia which can be caused from parrots or other birds. Now, he has not so much written to how people get now these chlamydia infections or what they now do. No, what they do, but where they are. Okay, whatever. People can get chlamydia infections, and if they get them, they are hard to diagnose, but it's treated with antibiotics, and they can cause a bunch of other diseases. but some of them might be treatable because the chlamydia bacteria are treatable. That was the chlamydia part. That was the medicine part. If you're here for medicine, you can go directly to the next part of medicine. We will do now the standing yoga. If you stay and participate in the standing yoga, then yeah, let's go. Go to stable stand. The feet are together. And you're breathing in and doing the eagle swings from the outside. And we're breathing out the outside. Again in the outside. And out and down. Again in the out. And now we're on the outside. And out on the arms to the side. The police on the side. Again in the outside. Out on to the other side. And in the outside. Out lean back for crab in the morning, draw a shoulder blades together. Again in the outside. Out leaning back, draw a shoulder blades together. Again in the outside. Your hands to touch and lean back for feet in the bed. Breathe in into the middle. Out again back. Again in. With the arm lean over to one side. In the middle. Out over to the other side. Again in. And now across the arms, intertwine the fingers reach high as glue. Without reaching front out of the back. Again in the outside. Change the intertwine. Breathe and reach high. Without reaching front. Again in the outside. And out. We're doing the down diving dorsal. Arms coming down. And we're just hanging down. Now we're doing the marble. Breathe in and bend the right leg. Then breathe out and stretch your left leg. Breathe in and change. And out and stretch your left leg. In and change. And out and stretch. In and change. Out and stretch. Now we're doing the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look up the right shoulder to the right. In, we head down. Out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in and down. And out and down. Now we're doing the marmot. Make a hand with, a pelican. Make a hand with space between the feet. Shift the weight to the heels and breathe in and come down. And breathe out and come up again. In and down. In, out and up. In and down. In, out and up. Now take hold on the elbows and gently rock from side to side. Hands again down, close the feet. Breathe and come halfway up into monkey half, lift straight back. Out and down. In and halfway up. Out and down. Breathe in and come up. The diving swan. Bring the hands touching down and down. Now we're doing the cashew. Feet are standing together. Hands behind the back intertwined. Breathe again in. And out, head over to one side and chin down to the clavicle. And pull the hands down to the ground. In and lift the gaze. And turn the head over to the other side. And out. Breathe again in. And out, chin down to the clavicle. Pull the hands down to the ground. In, lift the gaze and turn the head back into the middle. Now doing another exercise. Feet are standing shoulder wide apart. One hand behind the back. The other hand up, tall up, and we're bringing the head over. We don't pull, just bring it over. Now breathe in. And out, look up to the head. fingers. And back and down. The other arm behind the back. Take the other arm up and bring the head over to the other side. Down, pull. Breathe back in. And out, look up to where the fingers are. And back down. Now with Statue of Venus, go to the stable stance, intertwine your fingers behind the back, and bring them out to one side. Breathe in, turn up, shoulders back. And breathe out, bring the head over to one side. And the chin down. Breathe back in. And out, pull the arm and lift, shoulder down. In, lift the gaze, and bring the head over to the other side. Also the hands up to the other side. Turn up, shoulders back, breathe in. And out, chin down to the clavicle, pull the arm and lift, shoulder down. Lift the gaze and bring it back in. Now we're doing the sky hugger. The feet are standing together, breathing and lifting the arms up. And breathe out, lean back, long arms. And in and up. And out and back. In and up. Hold the arms down. And we're doing the eagle swings. We will lift the arms up. Breathe out the arms down. And then the arms up. Down. And now we're doing the last movement. The cactus collecting its things in the evening. Arms up, bring the hands to touch, and lower the hands down to heart center. That was the standing yoga. I thank you very much, and at the next step.